Hi, my name is Doel and I'm an IT specialist working for the government, and I've had a series of back problems for about 6 months now. I had slight pins and needles in my foot, pain, as I said, at the back of the hamstring area, but radiating down to the back of my heel, around the ankle area as well. The calf, not so bad, but those two areas mainly. I couldn't work anymore. I've been signed off work because of sitting. I'm a keen badminton player, that's gone. Keen cyclist, that's gone. Just walking was really painful. Driving a car, couldn't drive a car. Playing with the kids in the garden, playing frisbee, things like that. Anything that involved me on my feet for more than 5 minutes was just really painful. Yeah, so basically a brief history is I went to my GP who said that it will go away in a few weeks, gave me some exercises to do. That didn't really work, so I've got private insurance, so I actually went to see a spinal, or actually an orthopedic surgeon, where straight away he did some tests, reflex tests, things like that, and everything was fine. So he asked for an MRI scan, and I had an MRI, this was back in October. Had an MRI scan, and the scan came back and said that I had a herniated disc at the L5-S1 position. This was only 2-3 weeks into the injury. He said my options were to have surgery, to try physiotherapy, or maybe injections. Yeah, the surgeon I first saw, his opinion was, first of all, excuse me, that it was going to be a surgical was the best route. A surgery was the best route, but I was definitely not keen on having a surgery. That's why I tried the physiotherapy first. I went to physiotherapy, private physiotherapy, for around 6 to 8 weeks, and again it was a series of exercises with some stretching, which was the treatment I was given. And again, it wasn't really, some days I feel better, but on the main it wasn't really improving, and I decided myself to actually take a rest. I've never really rested, I've always followed the advice from the GP. So I took about 2-3 weeks off, and this was leading into December now. Again, I wasn't at work, and it did start to get a little bit better. I had some confidence, but as soon as I tried to walk or sit, the pain just came back immensely. So I decided that I need to seek another opinion. Speaking to some friends, I was recommended to come to this clinic here at Visby, and I've been coming here since December 12th. First of all, I was very worried about osteopathic treatment because I know of others who've been, and they told me there was a lot of clicking and crunching and wrenching, and being told I had a herniated disc, I really wasn't really keen on having that kind of treatment, but as I said, I needed another opinion. So my first impression, first of all, was how gentle the treatment was. No clicking, no crunching, hands-on, very therapeutic, very calming. And as I said, the first session I was surprised. Yeah, so December 12th is when I first visited here, and I was over the moon with my first treatment, where Visby said that I'm not a candidate for surgery, which gave me a huge boost. Equally, it's the psychological thing that I noticed the most, because I was in a bad place, worried about my back, thinking I'm never going to heal. I'm still healing, but if we'd done this video 3 months ago, this was a different person standing in front of the camera. So it's the psychological as well as the treatment on hands-on. Okay, so we're now February. We're now about 2.5 months or so into my treatment here. I'm standing here for a start, and that was, I could only stand for 5 minutes, probably hunched over more as well. I've driven here today. I wasn't able to drive without immense pain. It's there, but I know it's healing, and every treatment I have and every period of treatment I have in between, it's healing all the time. So physically I'm just improving all the time, and it's down to the treatment, I feel. I would definitely recommend this treatment for anyone who's suffering with this condition. What I've learned and in the last 2 months or 10 or so treatments is that you have to be patient. Vispi has a motto, I'm going to say on camera, which is if you're bored, you're getting cured. And I'm a very impatient person, really, and I've learned to be patient with this injury. You have to be patient with this injury and follow the advice. I wouldn't be standing here without this treatment, so I've still a little bit way to go, but I'd say I'm probably about 80% there now. So just do it, just come down and do it and get fixed.